Hello, I'm Dr. Brad Homer. I'm founder of Invisalign Have you ever had a case come back and there's just way too many aligners in a treatment plan they sent you, and you're kind of going, gee, is that going to really take that long? And you really don't know what to tell the patient. Perhaps there's a treatment consultation pending and everything. So in this particular case, I want to show you a case that I just did a little bit of maybe about 10 minutes of 3D control work, ran live update, and you'll see a significant reduction in the number of liners. Let's look at this case. The first thing I look at is, are there a lot of posterior movements? And I look at where she's at stage 0. And other than just a minor rotation of some of the premolar teeth, her occlusion is just really good. Here's stage 0. Stage 0. So there's unnecessary posterior movements. So I use the 3D controls. I just cancel the movements by right-clicking all of the posterior teeth, making them unmovable. And then for the premolar teeth, which need a little rotation, I just right-clicked them and made them movable. They stayed back at their original position, and then I just did a little bit of rotation, and I reset the arches without all those movements. Other than that, the anterior teeth need rotation. The incisal plane looks about right. I think it's just those posterior movements. I really didn't change or modify anterior movements much. I didn't cancel them because it's not necessary. You need to move anterior teeth to create the proper aesthetic outcome. So here's the initial treatment plan. Now, when you do 3D controls, you look at all the 3D controls work. It's not really specific. It just says I adjusted teeth. But I was really simplifying the posterior movements. Let's take a look at it now. After running live update and simplifying movements, there are only 19 upper active aligners. Remember, there were 40 before. This is the same treatment plan. All I did is use the 3D controls and ran live update and modified the arches like I just mentioned a few minutes ago. There's only really 10 lower aligners. Well, let's look at the movements. Now, can you see how simple this looks? The big challenge is going to be tooth number 10. And just for your information, it has an attachment that when you ran live update, it placed an attachment and optimized. I added a lingual attachment because I found out that I can go ahead and there's clearance to do that. You see, there's stage 0 and there's the last stage. So when I found out that there's occlusal clearance to do that, I added a lingual attachment. That blue level is just for rotation. There's so much rotation to begin with. And the lower anterior teeth look fine. If I were to do a little more 3D controls work for this case, I'd probably add some vertical attachments down here to help with this crown tip, correct this crown tip. But that adding attachments or changing the attachments is not going to increase the length of time. So here's a case where there's a dramatic improvement, reduction in aligners, just from using 3D controls for about 10 minutes and simplifying posterior movements and running live update. Let's look at the difference again. Let's look at the upper arch. So you can see this. It's the same amount of rotation, but there's so many posterior movements, and a lot of those posterior movements are repositioning the root apices of the teeth, and that takes time. So I hope that you are motivated to using the 3D controls. I have a lot of little short clips on how to use 3D controls, little tips and tricks and everything that I use, how to use 3D controls on my website, Invisaligndoctors.com. Check it out. And that's it.